ಕನ್ಯಾಕುಮಾರಿಯಲ್ಲಿ ನೋಡಿಸಿದ್ದೆ. ಅವ್ರು ಅದೇ ಹೇಳೋರು, ಏನಕ್ಕೆ ಯೋಗ ಅಂದರೆ ಯೋಗದಲ್ಲಿ ಆ ಪೋಸ್ಚರ್ಗಳನ್ನ ಪೇಚರ್ನ ತೆಗೆದುಬಿಟ್ಟು ನೋಡಿಬಿಟ್ರೆ ಪ್ರೆಗ್ನೆನ್ಸಿಯಲ್ಲಿ ಮಾಡೋವಂಥದ್ದು ಅದು ನೋಡಿದ ತಕ್ಷಣ ನಾರ್ಮಲ್ ಡೆಲಿವರಿ ಆಗುತ್ತೆ ಅಂತ ಆ ಥರ ಹೆದರಿಸ್ತಾರೆ ಅಂತ. ಸೊ ಯೋಗ ಅಂದರೆ ಒಂದು ಆಸನ ಅನ್ನೋದನ್ನು ತಲೆಯಲ್ಲಿ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದಾರೆ. ಇನ್ನೊಂದೇನಪ್ಪ ಅಂದರೆ ಯೋಗದಲ್ಲಿ ನಾವು ಮನಸ್ಸಿಗೂ ತುಂಬ ಪ್ರಾಧಾನ್ಯತೆ ಕೊಡಬೇಕು, ಎಸ್ಪೆಷಲಿ ಪ್ರೆಗ್ನೆನ್ಸಿನಲ್ಲಿ. ನಾನು ಅಕಸ್ಮಾತ್ ಎಲ್ಲರೂ ಹೇಳಿದ್ರೆ ಅಂದರೆ ಯೋಗ ಅಂದರೆ ಬರೀ ಆಸನ ಅಲ್ಲ, ಭಜನ್ಸು ಮತ್ತು ಮನಸ್ಸಿಗೆ ಮನೋಮಯ ಕೋಶ ಮತ್ತು ಪ್ರಾಣಮಯ ಕೋಶ ಎಲ್ಲದಕ್ಕೂ ವರ್ಕ್ ಆಗಬೇಕು. ಅದಕ್ಕೆ ಮಾಡಿದ್ರೆ ಕಂಪ್ಲೀಟ್ ಯೋಗ ಪ್ರೆಗ್ನೆನ್ಸಿಗೆ. ಇಲ್ಲಾಂದರೆ ಇಟ್ ಈಸ್ ನೋ ಇಸ್ ಜಿಮ್ ಮಾಡ್ಕೊಂಡು ಬರ್ಬೋದು ಆರಾಮಾಗಿ ಹೋಗಿ. ಪ್ರೆಗ್ನೆನ್ಸಿನಲ್ಲೂ ಅಷ್ಟೇ ಸ್ಲೋ ಎಕ್ಸಸೈಸನ್ನ ಮಾಡ್ಕೊಂಡು ಬರ್ಬೋದು. ಏನಂದರೆ ಆ ಮನಸ್ಸಿಗೂ ಕೂಡ ಹಿತವನ್ನು ಕೊಡಬೇಕು. ಆ ಮನಸ್ಸಿಗೆ ಹಿತ ತೊಗೊಳಕ್ಕೆ ರೆಡಿ ಇಲ್ಲ. ಟೆನ್ಷನಲ್ಲಿದ್ದರೆ ಅದು ಮಗುಗೆ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಗೊತ್ತಿಲ್ಲ. ಮೇಡಮ್ ಐ ಥಿಂಕ್ ಅದ್ರ ಮೇಲೆ ಬೆಳಗ್ಗೆ ಚೆಲ್ತಾರೆ ಬರ್ತೀನಿ. ಫೀಟಲ್ ಟಾಕ್ ಅಂತ ಬರುತ್ತೆ ಆ್ಯಕ್ಚುಲಿ. ಮಾಡರ್ನ್ ಕಾನ್ಸೆಪ್ಟು ಅದೇ ಹೇಳಿದ್ನಲ್ಲ, ಫೀಟಲ್ ಟಾಕ್ ಅಂತ ಹೇಳ್ಬಿಟ್ರೆ ಜನ ಬರ್ತಾರೆ. ಅದೇ ನಾರದ ಅಭಿಮನ್ಯು ಕಥೆಗಳಿಂದ ಚಕ್ರವ್ಯೂಹ ಭೇದಿಸೋದು ಅಂದರೆ ಕೇಳಲ್ಲ ಯಾರು, ಅದು ಫೀಟಲ್ ಟಾಕ್ ಅಂತ ನಂಬಲ್ಲ ಯಾರು. ಸೊ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಮತ್ತು ಆಗಿನ ಕಾಲದಲ್ಲಿ ಯಾಕೆ ಒಂದು ಒಳ್ಳೆಯ ಆಶ್ರಮದ ಪರಿಸರದಲ್ಲಿ ಪ್ರೆಗ್ನೆಂಟ್ ಲೇಡಿನ ಇಡೋರು ಅಂದರೆ, ಮಗು ಒಳಗಡೆ ಇರಬೇಕಾದ್ರೆ 1000 ವಿಷಯಗಳನ್ನು ಕೇಳಿ ಬುದ್ಧಿವಂತರಾಗಿ ಬಂದ್ಬಿಡೋದು. ಅದು ಇಟ್ಸ್ ಎ ಫೀಟಲ್ ಟಾಕ್. ಅದೇ ಹೇಳಿದ, ಇವಾಗ ಮಾಡರ್ನ್ ಟರ್ಮ್ಸಲ್ಲಿ ಅದನ್ನು ಫೀಟಲ್ ಟಾಕ್ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಅದು ಇಟ್ಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ. ಓಕೆನಾ? ಫೀಟಲ್ ಟಾಕ್ ಇಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ. ಜ್ಞಾಪಕ ಇಟ್ಕೊಳ್ಳಿದ್ದು. ಹೇಗೆ ಗಾಂಧೀಜಿಯ ಏನಂತಾರೆ, ಗಾಂಧೀಜಿಯ ಏನಂತಾರೆ ಅದಕ್ಕೊಂದು ಸೆಂಟೆನ್ಸ್ ಇದೆ, ಗಾಂಧೀಜಿಯ ಇದು ಪೂರ್ನೆಸ್ ಇಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ ಅಂತಾರೆ. ಏನೋ ಒಂದು ಇದು ಸೆಂಟೆನ್ಸ್ ಯಾಕೆ ಗಾಂಧೀಜಿಯ ಬಡತನ ಇಟ್ ಈಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿಯೆಸ್ಟ್ ಅಂತ. ಆ್ಯಕ್ಚುಲಿ ಅದು ಇಂಗ್ಲೀಷಲ್ಲಿ ಹೇಳ್ಬೇಕಾದ್ರೆ ನಿಮ್ದು ವರ್ಡ್ ಬರುತ್ತೆ. ಗಾಂಧೀಜಿ ಆ ಬಡತನವನ್ನು ಇದು ಮಾಡಿದ್ರಲ್ಲ, ಅಂದರೆ ಆ ಒಂದು ಸನ್ಯಾಸತ್ವವನ್ನು ತೊಗೊಂಡು ನಾನು ಹಿಂಗೆ ಇರ್ತೀನಿ ಅಂತ, ದಟ್ ಈಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿಯೆಸ್ಟ್ ಅಂತಾರೆ. ಇದು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು ಆ್ಯಕ್ಚುಲಿ. ಇದನ್ನು ಅದೇ ಥರನೇ ಫೀಟಲ್ ಟಾಕ್ ಈಸ್ ಏನಂದರೆ ನಾವು ಅಭಿಮನ್ಯು ಕಥೆ ಹೇಳಿದ್ರೆ ನಂಬಲ್ಲ. ಫೀಟಲ್ ಟಾಕ್ ಅಂದರೆ ಇಟ್ ಈಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ ಆ್ಯಕ್ಚುಲಿ. ಓಕೆ, ಸೊ ಅದರಿಂದ ಸ್ವಲ್ಪ ಯೋಗದ ಪ್ರೆಗ್ನೆನ್ಸಿ ಬಗ್ಗೆ ಏನೇನು ಆಗುತ್ತೆ ಅನ್ನೋದು ಗೊತ್ತಾಗಲಿ ಅಂತ ನಮ್ಮ ಸೆಂಟ್ರಲ್ಲಿರೋದು ಸುಮಾರು ಜನ ಜಸ್ಟ್ ನೀನು 1 ಇಯರ್ ಮ್ಯಾರಿಡು 2 ಇಯರ್ ಮ್ಯಾರಿಡ್ ಎಲ್ಲ ಇದ್ದಾರೆ. ಎಲ್ಲರಿಗೂ ಹೇಳಿದೆ, ಇವಾಗ ಬರೋಕ್ಕೆ ರೆಡಿ ಇಲ್ಲ. ನಾವೇನು ಮಾಡೋಣ ಹೇಳಿದ್ದೀನಿ, ಬರೋಕ್ಕೆ ರೆಡಿ ಇಲ್ಲ. ಸೊ ಈ ಥರ ಮಿಸ್ ಮಾಡ್ಕೊತಾರೆ. ಆಮೇಲೆ ಪ್ರೆಗ್ನೆಂಟ್ ಆದಾಗ ಬಂದು ಕೇಳ್ತಾರೆ ಏನು ಮಾಡಬೇಕು ಅಂತ. ಅದು ಯಾವಾಗ 5ನೇ ತಿಂಗಳಿಗೋ 7ನೇ ತಿಂಗಳಿಗೋ ಬರ್ತಾರೆ. ಏನು ಹೇಳ್ಕೊಡೋಣ ಅವ್ರಿಗೆ? ಇಟ್ ಈಸ್ ಜಸ್ಟ್ ಕಮರ್ಷಿಯಲ್ ಆಗಿ ಸುಮ್ಮನೆ ಗೊತ್ತಲ್ಲ, ಏನೋ ಒಂದು ಮುಖಕ್ಕೆ ಬಾಯಿ ತುಪ್ಪ ಸೌದಿ ಕಳಿಸೋದಷ್ಟೇ, ಮಾಡಿಬಿಟ್ಟು ಕಳಿಸೋದು. ಅದರಿಂದ ಯೋಗ ಇನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಇಟ್ ಇಸ್ ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟಾಪಿಕ್ ಆ್ಯಕ್ಚುಲಿ ಫಾರ್ ದ ನೆಕ್ಸ್ಟ್ ಜನ್ರೇಷನ್ ಅಥವಾ ಈ ಜನ್ರೇಷನ್ ಅಥವಾ ಫ್ಯೂಚರ್ ಜನ್ರೇಷನ್ ಟು ಗೆಟ್ ಎ ವೆರಿ ಗುಡ್ ಬೇಬಿ. ಬಟ್ ಸ್ಟಾರ್ಟಿಂಗಿಂದನೇ ಅದನ್ನು ಮಾಡ್ಕೊಂಡು ಬಂದರೆ ಇಟ್ ಈಸ್ ವೆರಿ ಗುಡ್. ಮೇಡಮ್ ಹೇಳ್ತಾ ಹೋಗ್ತಾರೆ, ಫಸ್ಟ್ ಟ್ರೈಮಿಸ್ಟರ್ ಏನು ಮಾಡಬೇಕು, ಸೆಕೆಂಡ್ ಟ್ರೈಮಿಸ್ಟರ್ ಏನು ಮಾಡಬೇಕು, ಥರ್ಡ್ ಟ್ರೈಮಿಸ್ಟರ್ ಏನು ಮಾಡಬೇಕು. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಯೋಗ ಮಾಡಬಾರ್ದು ಅಂತಿಲ್ಲ, ಅದಕ್ಕಿಂತ ಮುಂಚೆನೇ ಯೋಗ ಮಾಡಿರಬೇಕು. ಆವಾಗ ಹೆಲ್ತ್ ನಿಮಗೂ ಅಡ್ಜಸ್ಟ್ ಆಗಿ ಮತ್ತು ಆ ಯೋಗನೂ ಅಡ್ಜಸ್ಟ್ ಆಗಿ ಇಟ್ ಗಿವ್ಸ್ ಎ ವೆರಿ ಗುಡ್ ರಿಸಲ್ಟ್, ವೆರಿ ಗುಡ್ ಈಲ್ಡ್. ಕಮರ್ಷಿಯಲ್ ಟರ್ಮ್ಸ್ ಹೇಳಬೇಕು, ವೆರಿ ಗುಡ್ ಈಲ್ಡ್. ಬುದ್ಧಿವಂತದ್ದು ಅಥವಾ ಆರೋಗ್ಯವಂತ ಮಗುಗಳು ಬರ್ತಾ ಹೋಗುತ್ತೆ. ಇಲ್ಲ ಕೊನೆಗೆ ಮಾಡಿದ್ರೆ ಇಟ್ ಈಸ್ ಜಸ್ಟ್ ನಾನು ಇರೋದನ್ನು ಫ್ರಾಂಕಾಗಿ ಹೇಳ್ಕೊತೀನಿ. 7 ತಿಂಗಳು ಬಂದರೆ ಏನೋ ಒಂದಷ್ಟು ಫೀಸು ಅಂತ ಹೇಳ್ತೀವಿ, ಹೇಳ್ಕೊಡ್ತೀವಿ. ಹಾಂ, ನಿಮ್ಮನ್ನು ಯೂಸ್ ಮಾಡಿರ್ತಾರೆ. ಓಕೆ, ಸೊ ಈ ಮೇನ್ ಕಾನ್ಸೆಪ್ಟ್ಗಳು ಇಟ್ಕೊಂಡು ನಾನು ಯೋಗ ಇನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಪ್ಲ್ಯಾನ್ ಮಾಡಿದ್ದು. ಇದ್ರ ಜೊತೆಗೆ ಇನ್ನೊಂದು ಟಾಪಿಕ್ ಇನ್ಕ್ಲೂಡ್ ಆಗಿದೆ, ನ್ಯೂಟ್ರಿಷನ್ ಇನ್ ಲ್ಯಾಕ್ಟೇಟಿಂಗ್ ಮದರ್ಸ್ ಅಂತ. ಸೊ ಅದು ಕೂಡ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಕಾನ್ಸೆಪ್ಟ್ ಫಾರ್ ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್ಸ್. ಅದಕ್ಕೋಸ್ಕರ ಇದು ಮಾಡೋದು. ಸೊ ಯೋಗ ಇನ್ ಪ್ರೆಗ್ನೆನ್ಸಿ ಇಲ್ಲಿ ಇವರು ಏನು ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡ್ತಾರೆ ಅಂದರೆ ದೇ ಕಾನ್ಸಂಟ್ರೇಟ್ ಆನ್ ಆಸನಾಸು ಅದರಲ್ಲಿ ಏನು ಮಾಡಬೇಕು ಅಂತ. ನೆಕ್ಸ್ಟ್ ಟಾಕಲ್ಲಿ ಒಂದು 10 ಮಿನಿಟ್ಸ್ ಗ್ಯಾಪ್ ಕೊಟ್ಟು ನೆಕ್ಸ್ಟ್ ಟಾಕಲ್ಲಿ ಏನು ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡ್ತಾರೆ ಅಂದರೆ ಅಗೈನ್ ದೇ ಕಾನ್ಸಂಟ್ರೇಟ್ ಆನ್ ವಾಟ್ ಇಸ್ ದ ನ್ಯೂಟ್ರಿಷನ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಗಿವನ್ ಅಕಾರ್ಡಿಂಗ್ ಟು ಮಾಡರ್ನ್ ಟೆಕ್ನಾಲಜಿ. ಆಯುರ್ವೇದ ಕೇಳಿದ್ರೆ ಯಾರು ನಂಬಲ್ಲ, ಅದು ಕೊಡಿ ಇದು ಕೊಡಿ ಇದನ್ನು ನಂಬಲ್ಲ. ಅದಕ್ಕೋಸ್ಕರ ಇನ್ ಟರ್ಮ್ಸ್ ಆಫ್ ಕ್ಯಾಲರೀಸ್, ಓಕೆ, ಶಿ ವಿಲ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ಇನ್ ಟರ್ಮ್ಸ್ ಆಫ್ ಕ್ಯಾಲರೀಸ್. ಎಷ್ಟು ಕ್ಯಾಲರಿ ತಗೋಬೇಕು, ದಿನಕ್ಕೆ ಎಷ್ಟು ಕ್ಯಾಲರಿ ತಗೋಬೇಕು, ಪ್ರೆಗ್ನೆಂಟ್ ಆಗಿದ್ರೆ ಎಷ್ಟು ತಗೋಬೇಕು, ಲ್ಯಾಕ್ಟೇಟಿಂಗ್ ಮದರ್ಸ್ ಎಷ್ಟು ತಗೋಬೇಕು, ಸೊ ಅವರು ಹೇಳ್ತಾ ಹೋಗ್ತಾರೆ. ಓಕೆನಾ? ಇನ್ನು ನೆಕ್ಸ್ಟು ದಿಸ್ ದ ಟಾಪಿಕ್ ಇಂಟ್ರೊಡಕ್ಷನ್. ಇದು ನಮ್ಮ ಪ್ಲ್ಯಾನ್, ಅದಕ್ಕೋಸ್ಕರ ಟಾಪಿಕ್ನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದು. ಇಫ್ ಐ ಹ್ಯಾಡ್ ಟು ಇಂಟ್ರೊಡ್ಯೂಸ್ ರಮ್ಯಾ ಮೇಡಮ್ ಅಂದರೆ ಶಿ ಈಸ್ ಐ ಥಿಂಕ್ ಫ್ರಮ್ 3-4 ಇಯರ್ಸ್ ನನ್ನ ಸ್ಟೂಡೆಂಟ್ ಆಗಿದ್ದಾರೆ. 3 ಇಯರ್ಸಿಂದ ನನ್ನ ಸ್ಟೂಡೆಂಟ್ ಆಗಿದ್ದಾರೆ. ದರ್ ಇಸ್ ಅ ಲಾಡ್, ನೀವು ಯಾರು ಫ್ರೆಂಡ್ಸನ್ನು ಇದು ಮಾಡಿಕೊಂಡ್ರೆ ಅವ್ರ ಫ್ರೆಂಡ್ಸನ್ನು ಕೇಳಿದ್ರೆ ನೋಡ್ಬೋದು, ದರ್ ಇಸ್ ಅ ಲಾಟ್ ಆಫ್ ಚೇಂಜಸ್. ಶಿ ಕೇಮ್ ಆಸ್ ಎ ಏನು ಹೇಳ್ಬೋದು ಒನ್ ಆಫ್ ದ ಕೇಳಿಸ್ತಲ್ವಾ ಕಟ್ಟಾಗಿದೆ she came, I think I can say, she came with the zero knowledge about yoga. I can surely say that. Zero knowledge about yoga. Zero knowledge about yoga ಅಂತ ಬಂದು ಇವಾಗ ನಮ್ಮಲ್ಲೇ ಜನರಲ್ ಕ್ಲಾಸ್ನ ಅಟೆಂಡ್ ಮಾಡ್ತಾಯಿದ್ರು. ಅದಾದಮೇಲೆ YIC-ಯನ್ನು ಕಂಪ್ಲೀಟ್ ಮಾಡಿದ್ರು. YIC-ಯನ್ನು ಕಂಪ್ಲೀಟ್ ಮಾಡಿ ನಂತರ ಲೆವೆಲ್ 1 ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್ ಕೋರ್ಸ್ನ ಕಂಪ್ಲೀಟ್ ಮಾಡಿದ್ರು. ಲೆವೆಲ್ 1 ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್ ಆದರು, ಕಂಪ್ಲೀಟ್ ಅಲ್ಲ ಅದು. ಇಟ್ಸ್ ಎನ್ ಎಕ್ಸಾಮ್. ನಾನು ನಿಮಗೆ ಸುಮಾರು ಸಲ ಹೇಳ್ತೀನಿ, ಇಟ್ ಇಸ್ ಕಂಡಕ್ಟೆಡ್ ಬೈ ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ. ಓಕೆ, ಸೊ ಲೆವೆಲ್ 1 ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್, ಲೆವೆಲ್ 1 ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್, ಲೆವೆಲ್ 2 ಯೋಗ ಇನ್ಸ್ಟ್ರಕ್ಟರ್, ಲೆವೆಲ್ 3, ಲೆವೆಲ್ 4 ಅಂತ ಕೊಡ್ತಾರೆ. ಸೊ ಲೆವೆಲ್ 1 ಎಕ್ಸಾಮನ್ನು ಬರೆದು ಪ್ರಾಕ್ಟಿಕಲ್ಸ್ ಎಲ್ಲ ಬರೆದು ಐ ಥಿಂಕ್ ರವಿಶಂಕರ್ ಆಶ್ರಮದಲ್ಲಿ ಎಲ್ಲ ಅದನ್ನು ಪಾಸ್ ಮಾಡಿಕೊಟ್ರು. ಅದಾದಮೇಲೆ ಶಿ ಇವನ್ ಜಾಯಿನ್ ಟು MSc ಯೋಗ. ಓಕೆ, MSc ಯೋಗ ಮಾಡಿಕೊಂಡು ಫಸ್ಟ್ ಇಯರನ್ನು ಕಂಪ್ಲೀಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಇನ್ನು ನೆಕ್ಸ್ಟ್ 2-3 ಮಂತ್ಸಲ್ಲಿ. ಸೊ ದಟ್ಸ್ ವಾಟ್ ಹರ್ 3 years ಆಫ್ ಜರ್ನಿ. ಓಕೆ, ಸೊ ಇದ್ರ ಜೊತೆಗೆ ಯೋಗ ಪ್ರೆಗ್ನೆನ್ಸಿ ಇನ್ ಯೋಗ ಅಂತ ಒಂದು ಕೋರ್ಸ್ ಮಾಡಿಕೊಂಡ್ರು. ನಾನು ಅದಕ್ಕೆ ನಾವಾಗಲೇ ಹೇಳಿದ್ದು ಇಟ್ ಈಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ ಅಂತ. ಸೊ ಆ ಕೋರ್ಸನ್ನು ಕೂಡ ಮಾಡಿಕೊಂಡ್ರು. ಆ ಕೋರ್ಸನ್ನು ಮಾಡಿಕೊಂಡು ಇವಾಗ ಕಂಪ್ಲೀಟ್ ಯೋಗದಲ್ಲಿ ಅವರ ವರ್ಕನ್ನು ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಆ್ಯಸ್ ವೆಲ್ ಆಸ್ ಹೊಸದನ್ನು ಕಲಿಯೋದಕ್ಕೆ ಯಾವಾಗಲೂ ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. ಸೊ ದಟ್ ಈಸ್ ಅಬೌಟ್ ಹರ್ ಇಂಟ್ರೊಡಕ್ಷನ್. ಸೊ ನನಗೂ ಖುಷಿ ಆಗುತ್ತೆ, ಅವರ ನಮ್ಮ ಸ್ಟೂಡೆಂಟ್ ಟಾಪ್ನ ನಾನು ಕೂತ್ಕೊಂಡು ಕೇಳೋದಕ್ಕೆ ತುಂಬ ಖುಷಿ ಆಗುತ್ತೆ. ಐ ಥಿಂಕ್ ಶಿ ವಿಲ್ ಶೋ ದ ಇಂಪ್ರೂವ್ಮೆಂಟ್. ಲಾಸ್ಟ್ ಟೈಮ್ ಈ ಟೈಮ್ ತುಂಬ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿದೆ ಅಂತ ಸ್ಲೈಡ್ಸ್ ನೋಡಿದ್ರೆ ನನಗೆ ಅರ್ಥ ಆಯಿತು. ವಿ ವಿಲ್ ಸಿ, ವಿ ವಿಲ್ ವೇಟ್ ಫಾರ್ ಹರ್ ಟಾಕ್. ಮೇಡಮ್, ನೀವು ಬಿಟ್ಕೊಟ್ಟಿದ್ದೀನಿ, ಓಕೆನಾ? ಸ್ಟಾರ್ಟ್. ಮಾತಾಡಿ ಕೇಳಿಸುತ್ತೆ. ಹಾಂ, ಸ್ವಲ್ಪ ಜೋರ ಫೇಸ್ ಇಲ್ಲ, ಫೇಸ್ ಆಮೇಲೆ ಫೋಟೋ ಕಳಿಸ್ತೀನಿ ಅಂತಾರೆ.
ಫೋಟೋ ಕಳಿಸ್ತೀವಿ ಮೇಡಮ್. ಅಲ್ಲ, ನಿಮಗೆ PPT ಕಾಣಿಸ್ತಾ ಇದೆಯಾ? ಹಾಂ, ದೆನ್ ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಫೈನ್. Namaste to one and all present here. So sir already introduction ಕೊಟ್ಟಿದ್ದಾರೆ. ಮತ್ತೆ in fact sir ಹೇಳಿದ್ದು, it has not only given the introduction, it has given the complete overview of the topic. So ಇವಾಗ ಅದನ್ನೇ ಸ್ಲೈಡ್ಸ್ ಮೂಲಕ we will be going.
ಅಲ್ಲಿ ಬರೀ ಪಾಯಿಂಟ್ ಹೋಗ್ಬೇಕಾಗತ್ತೆ. ಸ್ಲೈಡ್ ಚೇಂಜ್ ಆಗಲ್ಲ, ಸ್ಲೈಡ್ ಚೇಂಜ್ ನೀವು ಮಾಡ್ಕೋಬೇಕು. ಡೌನ್
ಸರಿ, ನಿಂತ್ಕೊಳ್ಳಲ್ಲ.
ಸ್ಲಾಶ್ ಮಾಡ್ಕೊಳ್ತೀವಿ.
So today my topic is pre and post pregnancy. Now today I would like to discuss and share about the basic concepts or the fundamental ideas in pregnancy related to pregnancy related to physiology, and even we will be discussing and sharing about the psychology also. So let us first go through. At certain days what we do, we will be in certain areas and we just want to go through. I am talking about especially cooking now. We will be going through some recipes. Just we'll go through the net and we'll be in such urgency, urgency or that type of mood, we will just jump into the recipe. The same way, I am going to just jump to the fundamentals, and later we will be, after understanding that fundamentals, we will be able to give the answers for the first 2 slides. So here, I am actually very much interested in this slide. So that what we are going to do with this is we are going to learn some of the few of the basic concepts here. One thing is the deep abdominal core, and that is the muscles, deep abdominal muscles. The next one, the pelvic muscles, pelvic floor muscles, and the back, that is the multifidus. So here, what happens? So this is the deep abdominal muscles, one of the deep abdominal muscle, that is transverse abdominis. And here the pelvic floor muscles, here the multifidus. This multifidus is that it is by the side of the spine. This is very important. So all these physiological changes, the basics that runs with these 3 things, and this is altogether the lumbopelvic cylinder. Just remember this, very important. Lordosis. So what is this lordosis? Lordosis is the excessive inward curve of the spine. We can see here in the first figure, this excessive inward of the spine is due to the shift of center of gravity. Shift of gravity, COG, shortly mentioned as COG. So what happens here, in the normal human, the center of gravity position, you can see this, okay. And in the pregnant woman, we can go through this, there is a shift of gravity. This is because of the belly bulging, that is we are giving the room or accommodation for the baby. So what happens here, the main thing, shift of gravity. With the shift of gravity, what happens? There is a tilt in the pelvic floor, there is a tilt in the pelvis. Here there is no shift of gravity, so you can see this line, and here there is the pelvic tilt forward and upward and forward. So here the same thing, because of the pelvic tilt there is the increased lordotic curve, because you will be having the pressure in the front as there is belly bulging. So the muscles will be stretched and you will be having the increased lordotic curve. What happens because of this? We will be hearing most of the pregnant women saying there is lot of back pain. The main cause for this is because of this lordotic curve. Core stability. Now from the fundamentals, that is deep abdominal muscles, pelvic floor and the back, we have come to the core stability. Again we will see those things in this. What is this core stability? Having a strong core is nothing but to strengthen our core muscles. Like we can say, any idea about core stability? Is the flattened stomach just a can we say if we have a flattened stomach, our abdominal muscles are very strong? Nanda madam, are you in line? Hello? Kelsa madam? Okay. Another answer Kelsa. Can we say, like, if we have a flattened stomach, then if we only have the flattened stomach, then our core muscles are strong? No. It is like if we are going strong with our core muscles, means building up our core muscles. So here, core stability, the chain has been given, transverse abdominis, that is one of the deep core muscles we went in our first slide, and this one multifidus, and with this even the diaphragm, pelvic floor, internal obliques and rectus abdominis. So this rectus abdominis we will be going in detail with this in the further slides, and we will just move to the next one. What happens in pregnancy time is, as we have to accommodate the baby, there will be like our muscles will be overstretched, and because of that there will be weakness in the muscles, and during pregnancy there will be a release of hormone called relaxin. So because of that there will be more flexibility. It gives more flexibility for our body. Here what happens generally, that I have said, that core muscles will become weak. So what we have to do? So we will come to that later. Thus we will concentrate on this. I have just read the muscles, and these muscles here they have given the lines. This is how the muscles will not just go like in just one plane. It will be like crosswards, diagonal, parallel, and here this parallel one is rectus abdominis, transverse, internal obliques, transverse abdominis. Okay, this transverse abdominis is very important in delivery, because in labor this is the one muscle which pushes out the baby with the help of the pelvic floor. Both two things that are very important is transverse abdominis, the deep one of the deep internal muscle, core muscle, and one more is pelvic floor. So with this slide we have come to know that how important is that we have to keep our core muscles strong and our pelvic floor muscles strong. So what we have to do, we will go with it later. Here the same thing as been shown, the cylinder, lumbopelvic cylinder. Okay. Here it is in diagram, and this one is in picture. We'll go for the next line. Diastasis recti. Diastasis recti is the separation, like partial or complete separation of the rectus abdominis. As if just now we went through the deep internal, like deep core muscles. So one is transverse abdominis, the other one rectus abdominis, that we are going to concentrate mainly with this slide. So why this happens? This happens the same thing here. Once again we are going to lead with is for the accommodation of the baby. So what happens as the baby is accommodated, we are giving the room for the baby, the muscles, the core muscle stretches. One thing again and again I will be repeating this. You will while finishing the class you will have very deep into your mind. Okay. So with this, how we have to take care of this, like how we can manage this. Actually, as before, I said like sir has given the overall view. So sir has mentioned about the what we have to do before the abuse, doing the household chores, all those things. So here we will link about that one. What happens here is in the first trimester, that is first trimester comes from the first week to the 12 weeks. Okay. So in this part of time, if the woman, pregnant woman, is undergoing with squatting, lot of weightlifting, and very dynamic practices. So what happens with all these things is this separation becomes more, and that is one of the main causes. So before in our houses, the elders would say, don't do this, don't do that, all those things. So this is one of the reasons. Okay, this is the main reason. And this is about most of the 30 to 40% of the women nowadays they are taking these challenges. Okay, so once we go through what are the things, what are the obstacles, how are the things, once we are aware of these things, we will be able to tackle, or we will be able to run smoothly with that way. So here this one, like before pregnancy, and that is like I have to mention before pregnancy, and the diastasis recti during pregnancy. You can see this, and this is diastasis recti after pregnancy. So it takes about 3 weeks after the castration, that is after the labor. It takes about 3 to 6 weeks to heal. In most of the people, in most of the women, what happens is it just goes on till 6 months, and it just continues. So there will be like we can give exercises or practices for them. So better thing like is prevention before here. Okay. Next is pelvic girdle pain, PGP or SPD, symphysis fluid dysfunction. So what happens here? This is the discomfort in your pelvic joints, that is front of the front, and also might be front or back of the pelvis during. This will be mostly found during your third trimester. Third trimester is the last 3 months. So why does this happen? And this is almost like in 2/3 of the women. This is faced almost like in 2/3 of the women. So here what happens? You can see the pelvis here. There is 2 bones, the pelvic bones joined in a pubic symphysis joint. So here the muscles, there will be pack of deep ligaments surrounded with this. So that gives the stability. That gives the stability for the pelvic floor. Here what happens? You can see there is the pelvic bone, and the joint is becoming, the joint has become like exaggerated a little bit more, and this is because of the weakness or due to the stretching. Okay, so what we have to do for this? What do we learn from this life? From this we have come to know about our pelvic floor. So our pelvic floor must be strong. So we should have in the mind, like we should strengthen our core muscles, pelvic floor muscles, and the back muscles. One more thing I would like to say, the back muscles, the main functions of this back, the core muscles, the main function of this core is like it gives the stability, and it gives the support for your back, and stability also is there for the pelvic floor. It strengthens both the things. So we may basically concentrate on these things. Changes in pregnancy. First, pregnancy. So pregnancy, many of them would have undergone. I do feel like you can say a few points on this. Yes, please. ನೀವು ಈ ಥರ ಇದ್ರೆ ಎಂತ ಹೇಳೋದು ಮೇಡಮ್, ಮಾತಾಡಿ ಯಾರಾದರೂ.
Like what should know?
Means
Like what if you know, I should tell the changes.
No, madam, not in that way. Generally, when we are pregnant, what do we feel?
ನಮಗೆ ದುಡ್ಡು ಜಾಸ್ತಿ ಖರ್ಚ ಆಗುತ್ತೆ.
So, okay. First, we will go for pregnancy. Pregnancy is the state of carrying a developing fetus in a woman's womb. So, I would feel it's a boon for motherhood. So later, we will catch up in the other slides with this. And now, this pregnancy is being divided into 3 sections. Okay, first trimester, second trimester, and third trimester. The first trimester will be from first week to the 12 weeks, and the second trimester from 12 weeks to 28 weeks, and the third trimester will be from 28 to 40, 29 to 40, 28 or 29 to 40 weeks. So here the next is pasteurization. Oh, sorry, missed the slide. Okay, we will come to that again. I will continue with this. So there are changes in pregnancy. So I'll just go with an example. If we just have a cyst or some pimple, something which is a little bit big on our body, what do we feel? What are the things we are knowing with that? What is that? It's a cyst. Pimple or some cyst inside our body. Pain. Pimple will be also cyst. Pain. Pain. If it is a little bit bigger.
See, some cyst it will not cause anything. Like it will not create any symptoms. It will just develop, that's all.
Now I am asking, what is your feeling about it? You will be always irritated till you see a doctor. You will be having a lot of stress with it. Might be a big thing, and if it might be a small thing, if it is a big thing, then you will definitely we will see in the doctors, like in a clinic or hospital.
And when you may create a menstrual problem also.
I will get you, madam.
Menstrual problem.
Periods problem.
Periods problem.
Okay.
If we have a cyst, then it can create.
Okay. Okay, we will deal with this later. So what my idea was, even a small cyst or pimple on the body, what do we feel, how much stress we feel. And here in pregnancy, what is happening? Just imagine a single cell, just a single cell, which is not even visible with our eyes. A single cell growing and multiplying, and we are getting it as a baby of 2.7 kgs or 3.5, 3.15 kgs. How is this possible? And this miracle is only with this miracle is going on with the pregnant woman, that is woman. Okay. So, okay. So body, what has to be done? How the body adjusts for this? So this big thing, the body has to adjust so much and adopt for it so much. So much we are doing. If you just imagine it, you can feel my words, I think so. Nanda madam, hello. ಕೇಳ್ತಾ ಇದ್ದೀರಾ? ನೀವೇನು ಹೇಳಲ್ವಾ? ಓಕೆ ನಾ ಎಲ್ಲ ಹೊರಟೋಗಿದ್ದೀರಾ? Okay, now we will be like this changes or like this. Sorry, madam. Okay. This changes, we are dividing it into physiological changes and psychological changes. Here in this figure, we have given few of the physiological changes that takes place. I will be going very in short with this. So, cardiovascular system, the changes takes place in the cardiovascular system, respiratory system, gastrointestinal system, endocrine system, breast, abdomen, musculoskeletal system, skin, and urinary system. So, in this cardiovascular system, the cardiac output will be more. As what we are doing, because we are nurturing, we have to nurture the baby. The nutrients must be given, the oxygen must be supplied. There are so many things going on inside. And here in respiratory system, the respiration, the oxygen intake, the respiration will be more about like 50%. But when we are normal and compared during the pregnancy, it is about 50% more. So there are a lot of changes going through these things, and changes to our body during pregnancy and potential aches and pains. This is what the main reason for this is the first slide. We went through that all those fundamentals. So what happens with COG, center of gravity? There is shift of center of gravity. The pelvic floor, there is a tilt, and because of that there are postural changes, and because of this postural changes there are body pains and pains, and even this as all these things, the main reason or the main factor contributing with these things is the hormonal changes. Without these hormones, like nothing is possible. The hormones plays a very main important role in this. So duration I have already explained for this. First trimester, second trimester, third trimester. Past duration is nothing but the labor. And here we are going with the labor or the delivery. So 37 weeks to 40 weeks early term, and before 37 weeks preterm, 40th week full term, after 40th week late term. So we should, what I think is, let me have a small understanding of this. What happens in this early term? In the early term, the baby has to be at mature. It's not completed, it's not completed fully. So it should be at mature. And when there is a delivery at this time, then the baby should be kept in the incubator. Yes, I see. Then with this 37 weeks to 40 weeks, it is an ideal period for the delivery. What happens in this after 40 weeks? After 40 weeks, what happens once the baby is completely grown? It starts to excrete on its own. So this becomes one of the complications. And again, after like the baby is completely grown, the head, the skull starts becoming hard. So that becomes one of the complications during the pregnancy. These are just the things like I put to remember. Now, challenges faced in pregnancy. Over this line, what I would like to convey is, so from the last slides, we have seen a lot of changes, physiological changes, psychological changes, and some fundamental ideas about it, the core muscles, pelvic floor, all those things. And in this line, we are going to see the challenges. What I do think is, once this point I have already mentioned, I will repeat it again. Once we are aware of the obstacles in our way, then we will be prepared for it. So preparation, with preparation, if we are dealing with something, then the way runs very smoothly. So that's why, like, once we will go with these challenges, and then we will move with the first, second and third trimesters. So challenges faced in pregnancy: pregnancy-induced hypotension, GDM, abortion like miscarriage, and eclampsia, intrauterine growth retardation. Pregnancy-induced hypotension. hypertension. So about this is the hypertension. It will be newly developed during or after the 20th weeks. So before we would not be experiencing this. Before we will not be having this hypertension. It is newly developing at the 20th weeks. So one of the main reasons here is lifestyle. The factor responsible for this is lifestyle, and many more things will be going through again. So with this hypertension, if it goes on, the hypertension, if it is increased, then it leads to eclampsia. Eclampsia is a high risk. It is very high risk. What are the things like will be faced because of that stillbirth and intrauterine growth. What I have said, I will explain it later. And the nutrition is very poor. If the nutrition will be very poor in the intrauterine growth. So let us move to the next slide. Gestational diabetes mellitus. This is also one of the things that is newly developing during the pregnancy. So why we are going through this? One of the reasons, like many of the women, pregnant women, even I have seen in my experience, like one of my participants even said that before she was not aware of these things. If she was aware of these things, she would have maintained in her diet. So, like as Sir said in the starting, in the overview, we should think about it very deeply. Okay. So, what happens in this gestational diabetes? The high blood sugar in the mother's blood, the sugar level will be high. And what happens because of this? The blood passes to the baby. So there is a lot of sugar to the baby, and the baby gains weight. If normally there is a gain weight, what happens? Again the complication for the delivery. So, intrauterine growth retardation. This is where there is a lot of difference, and we can see there is a growth retardation in the baby. This is because of the internal environment where the baby is. It is in the womb because of the internal environment. There are more factors supporting this. So we can see the baby here of fetus here of 27 weeks. The same means the same weeks of 27 weeks. We can see the growth difference. So here the factors that are responsible for this is poor nutrition. And might be even chromosomal abnormalities, and even because of the environmental injuries like radiation and infections. So what we are going to do is how we are going to manage this. Proper nutrition. Proper nutrition, one of the main things. Okay. So we will be seeing that in the later slides. Oh, seeing this slide is very refreshing and energetic. As if now we went with lot of slides, going through the challenges, all those things. This is making me very refreshing and enjoying and energetic also. So, yogic diet. Now, after after this session, there is a very interesting session by Madam. Again, going very deeply into the diet. So we will enjoy that more. And now I'll make it this short and very sweet. What makes this yogic diet? The name itself says yogic diet, different from the other. The difference is in sattvic food and moderation. Moderation, the key. So what is the sattvic food? The sattvic food is the food which is full of vitality, health and strength. It gives us cheerfulness. Because of the health we are getting happiness, and because of the strength, stamina. So what we want during pregnancy, because of this becomes the main thing. See, for like in food, actually Sir has mentioned this in Ayurveda about it in the first in the introduction. So we will be continuing with the same thing. So food is the main cause. We can manage with the food. It gives this, with this yogic diet, we can go through like happy, enjoying and peaceful and harmony during the pregnancy. What we want more? We are striving for these things only. Enjoy, peace and harmony. So with that, for the first trimester, what we are going to do? Mother, excessive vomiting, cravings for the food, aversions for the food and mood swings. This all basically is because of the hormonal changes. And I would like to mention excessive vomiting. This is nothing like everyone should face this or everyone should go through this. There is nothing like that. There are mothers like pregnant women who face this vomiting from the first month till the complete 9 months. And few of them are very relaxed, very peaceful from the first month till the 9 months, the complete thing. So what here is excessive vomiting. This is excessive vomiting. There are other factors also, but in the first month, we are talking about first trimester, right? So in the first month, we will be going this vomiting is due to the hormonal changes, and one of the hormone is HCG, which is responsible for this. And even when we want to check our pregnancy, we will check with the strip, isn't it? So this is one of the hormones which is responsible for it. Okay. Next, fetus formation. So here in the first month is just growing and developing, first, second and third. So here are the stages of the fetus development. Week 5, week 7, development of eyes, week 9, visible earlobe. Okay. Here in this week, we can see the basic facial features are in place. There are some others in the first week. She will be undergoing lots of these mood swings also. So how we are going to tackle this with yoga? We will be seeing it later. That means yoga helps. Okay. How? We will be seeing it later. In the second trimester, what happens here? The mother has a stable period. She experiences this vomiting, mood swings, and many more things as it comes stage by stage, first month, second month, third month. When she is stepping into the fourth month, she will become stable. This all things reduces normally. Fetus, steady growth and maturity. So stages of the fetal development in the 14th week, transparent skin in 18th and 14th week, like we can see this transparent skin. skin and hair growing in 22nd week to 26th week, hair growing, developing fat, baby can open his eyes. And one more thing, in the 18th week, the baby is able to hear. And this is very important. This is very important for your fetal talk. So this is like how everything, whatever the mother experiences, is experienced by the baby. We will go in detail when there is a fetal talk. Okay. And in 26th week, there is a small kicks by the baby, and this kicks is called as quickening. And the mother, if the mother is in first pregnancy, she will take a little bit of time to recognize this, and it starts from almost like 18 to 20 weeks itself. If she is like second, she might recognize it very earlier. So third trimester, mother tiredness and body pains. This is where we went about the pains, that pelvic girdle pain, back pain, all those things, and this is due to the yeah, giving the room for the baby. Fetus maturity. So fetus, it has been like matured. That is, all the organs of the fetus and all the systems of the fetus has been matured in the third trimester. So, and it's like preparation for labor. So how the body gets prepared for the labor. I think that is like how it relaxes, the body itself relaxes. There are hormones for it. Okay. We'll go to the next slide. Anxiety during pregnancy. So, anxiety during pregnancy. This is one of the, what is this actually speaking? We do have the fear about the labor, means about the labor pains, the baby, how the baby is, how I am going to face this, all these things. So how we are going to handle these things? How to overcome this fear? With knowledge and motivation. So when, before, like in our houses, we will, the people, like our grandmothers, our elders, they used to say us, they used to talk with us more about all these things. There is nothing fear, like it is a normal for every woman, all those things. These things are full of values. Actually, they are building us with lot of strength. So this is what we are missing nowadays. We will go through this in later slides again. Labor and pasteurization. So anyone wants break? A bit of water. I feel like anyone's sleeping. I would like to have a little water. Then.
They can hear me, right?
ಎಲ್ಲ ಒಂದ್ಸತಿ ಎಲ್ಲ ಕೂತ್ಕೊಬಿಡೋಣ.
Very slow.
I'll be running now. Now we have come to labor and pasteurization. So pasteurization means childbirth. There are 3 stages in this. First, it will be going with the cervical dilation, and I would like to mention one interesting point in this. What happens is regularly our cervix will be just like the tip of our nose, 2 centimeters so, and in labor it has to dilate for about 9 to 10 centimeters. Still So the second stage is delivery of the fetus. The third one is expulsion of the placenta. Even there are added one more stage, we can say fourth stage as lactation. Okay. Here in stage 1, the cervix relaxes, causing it to dilate and thin out. So these things depend even on our confidence, self-confidence, that we will be talking in later slides. Here, uterine contraction, increasing strength, and infant is delivered. So here we have to remember our pelvic floor muscles, transverse abdominis. If they are strong, then the delivery will be like easy. Helps in easy and normal delivery till the placenta is expelled. Okay, high risk pregnancy. So in this we are going to see who are considered as high risk comes under this category, high risk pregnancy. Young mothers, elderly mothers, multiple pregnancy with underlying complications. Complications, those we have taught like challenges that we are facing. And autoimmune diseases all fall under this category. And the main factors that contribute for this is age, lifestyle, and the condition of pregnancy. So IUID for pregnancy. As you're all like YIC students, you know about this IUID. I will do this in a very short period, like Annamaya Kosha. What we are going to do with this: loosening, asanas and kriya, pranamaya kosha, breathing and pranayama, manomaya kosha, dhyana, bhakti, devotional songs, Vignana Kosha, Jnana, lecture and yogic counseling. So this one you have already gone through, I think so. That will be again. Yes? No? In the US Department of Health and Human Services for Pregnant Women has said that at least 150 minutes per week. What is the prenatal yoga? At least 150 minutes per minute. That is almost like 3 classes, 180 minutes per week to become like healthy and to make our cores strengthen. And prenatal yoga, a wide range of benefits for mom to be and baby. Sorry, sir. Modified yoga practices, first trimester practices. So, most of the people who do this yoga itself, like before becoming pregnant, what they do when they become pregnant, they just see to that. They will be having a lot of reasons and they themselves will be having a lot of fear and anxiety. What happens with this? But we have to know, if we are going for a trained yoga instructor, that is prenatal yoga, they will take care of all these things because they have trained for it, right? So what we are going
to do? Usually what we face the problem is they come for the pregnancy, okay, to get pregnant. So they will have some certain problems, PCOD, some problems they will have. They will come for that, okay. They will do that, they will do yoga, they will properly perform yoga, and within 6 months or 8 months they get conceived, okay. They will come to know after 2 months or 3 months, they are conceived. Once they came to know that the third month, that means they are conceived, that time they will stop yoga. Because in the home, again, misinformation. They say, don't do yoga. Oh, it will get aborted or it will get removed. The attached embryo. They think in that way. Actually, they come for the pregnancy, they got the pregnancy. After 3 months, when they come to know, until that time it will be, everything will be okay. Then leave the yoga at the third month. Then they come at the 9th month or 8th month to do yoga. By that time, all the bodies, yeah, same. That stretching, stretching and all gone. So they will lose it.
So one of the important things to remember here is like all the 3 trimesters will not be having all the same practices. The first trimester will be having different, and the second trimester different, the third trimester different. What we are going to do in the first trimester we will not be able to do in our second or third trimesters. So this first trimester practices are very, very important. As we are concerned with this, like we went for that GDM, and most of the women, 90% of the women, they undergo this thyroid, hypothyroid. So all these things, we will be like the practices, the specific practices, we can take care of all these things. So here I would like to specify few of the yoga practices like Viparita Karni, Ashwini Mudra, and that is for to strengthen our pelvic floor. And the first trimester, we don't want any miscarriage. The baby should be like healthy. We will be going with certain practices, specific practices, and with GDM we are going to do Ardha Shriyasana, and for thyroid, Vishyasana. So, okay, and avoid acute extreme bends. You should avoid acute extreme bends and know that in practices, avoid Kapalabhati also. Second trimester practices. So mother is happy here, and she is stable, and even we are making yoga practices stabilized. We are going to increase pranayama and increase the chantings. Third trimester, most of the asanas cannot be performed, and mainly the shavasana in lateral position. This as one of the main important reasons. What happens here is Vignana Kendra. That is one of the things. When we give this GRT or Yoga Nidra in the lateral position, what happens is like the pressure builds on for the baby. Actually, I have kept this slide here. Yeah, you can see the Vignana Kendra here. So this is the way. And what happens here is in our lateral position, the baby is on this. So that what happens, this is the problem with the less blood flow. Okay. So that's why we are not going to give them Shavasana. We are going to give them in a lateral position, and sleeping also. When regularly during the pregnancy, we will be going to the sideways, okay, not on the back. Then we are going with the meditation. Meditation, why we are going, it comes from the mind, and it is like I will be going through this in the slides, I think. So relaxation techniques, Yoga Nidra, DRT, meditation and music. Fetal talk. Fetal talk is talking to the baby. And I consider this as one of the most important thing. So, Sir has already quoted on this thing. So this is a way for building the personality development and the development of skills in our baby. Okay. So what happens, what is here, what is going to be done here is we are creating, we are shaping, we are giving shape for our baby. It doesn't start from 1 year, after 6 months after the baby is born. It starts when the baby is in the womb itself. So we went in the slides before, we went that the baby can hear and the baby can feel the sensations from after the 26 weeks, all those things. So that all comes here. That when whatever like we feel, the baby feels, how will be explained in the next slide. And here, this is what happens with this. What happens with this development, personality development, and personality development, and one more point I have said. Development of skills. Okay. With this, the baby starts learning earlier. The baby starts grasping easier. The baby has a lot of IQ. So, what do we want? What do we want from our baby? We want our baby to be brilliant, intelligent, healthy. Is that yes or no? We want everything. We want him to be a hero. Hero, heroine. Okay. So, as we do see so many things, it's just we give the inputs here itself. We start giving the inputs here itself. So, my baby wants to be a doctor, my baby wants to do this, my baby wants to do that. What are going to give the inputs here will be going in South Sea. Okay? So in South Seeding, spiritual inputs, stories from the scriptures, mantra japa, chantings, devotional songs. Here, when we are pregnant itself, we have become a teacher for our baby, or we want our baby to learn a lot of things. It is proved that whatever we give the inputs, in some or the other time in the baby's lifetime, in some or the other way, it is shown. Okay, we can see that. So the inputs, like what I said now, for good health, for the baby, like my baby wants to be like this, my baby wants to be like that. So all these things should be given by the mother at this time. And what happens because of this? Because of this, there is a good link between the mother and the baby. And this makes the mother a confident and healthy, charming, happy, that paves the way for normal delivery. So in this thing, in fetal talk, there are so many examples, so many, like once I have went to a workshop and they have shared it, like it works a lot. So these things, once the mother becomes calm, relaxed, and what is there? We will go for the next slide. Now, postnatal after birth. Postnatal. So already we have went into the third trimester. The practice will be very blessed. And mainly we will be concentrating on pranayama, and yogic counseling will be given, all those things. In this, the same way as we are starting, as after the labor and after the delivery, after 3 weeks or 6 weeks, as we are starting, the practices should be very slow. As during the delivery, there is a loss of strength in the comages, pelvic floor, and totally there is we have to recover everything. So in postnatal, the recovery should be like slow and steady. We should not go through like I was doing that. Remember the stage of the body. We have to give the time for that. Do not hurry. So here acute back pains, we should avoid acute back pains because we have gone through that diastasis recti. So already there is a secretion and not make it more, and a few other reasons also, and pranayama will be very much helpful here. Safety tips: be patient and positive, practice regularly, try not to focus on the negative, ensure that eat a nutritious diet, Ayurvedic massages will help, fertility levels are higher when you are younger. I mentioned about the age, one of the reasons for the complications. So here I have given like fertility levels are higher when you are younger. Conclusion. So yoga is a safe, simple and natural method for preparing the pregnant woman for delivery and the child for birth. So here this practice brings about acceptance, peace and harmony with the entire family. How is this possible? After all these things, how is this possible? So, what happens here? Mind. Yoga. Yoga is? Yes, please. Hey, madam, parvailla. Into. Okay, madam, Nanda, madam. Hello? Yoga is? ಯೋಗದಿಂದ ಏನಾಗುತ್ತೆ ಮೇಡಮ್? ಓಕೆ ಓಕೆ ಸೊ it's not only like asanas. Here we are going with mind and body connection. Okay, madam, thank you. Here we are going with the mind and body connection. So, in yoga, what we do? There is the upliftment in all the levels, improvement in all the levels, like physical, mental, pranic, spiritual. It's an overall development. It is holistic. That's why you prepare yoga. And this is because of yoga helps in maintaining calmness at all times in all our actions. And thus it is defined as a tool for positive health. So, and while we are in this way, our outlook is changed towards other things, how we see the things. We become more confident, and that confidence makes us more happy. And when we have the look to the baby, we feel a lot of support with this. So these all things plays a good journey, good path for us. Pregnancy becomes unique, exciting and joyous time in a woman's life as it highlights the woman's amazing creative and nurturing parts while providing a bridge to the future with yoga. It is like we are a pregnant woman or a woman are giving a gift for the family and the society. Thank you. Thank you all.